Good morning. Hammersmith?
Down here.
And Charing Cross, good morning to you.
Morning, Lily.
St Mary's. We have A&E with us.
Morning. I think we've got 15 patients in the department. 6 are over 4 hours. 3 of those are waiting for a psych bed. One's been allocated, but she's waiting for transport.
Just to highlight, the first psych patient's now been in A&E for 22 hours. That patient's caused lots of disruption overnight, has assaulted various members of staff. The police have been called.
A woman is being cared for in room Q, a dedicated space in A&E for psychiatric patients. She arrived in an agitated state yesterday morning.
Just concerned about this mental health patient in A&E for 22 hours. It's difficult to handle because they're so aggressive and violent. Going through the notes, they've assaulted 5 members of staff throughout the night shift. She's a very big lady and she's difficult to handle. She got seen by the mental health team. They booked a normal mental health bed. But then she got so aggressive when the crew turned up to take her. They said she needed a psychiatric intensive care bed, which is in like a locked room. So there's very few of them in London. So the new bed was then identified, but now we're waiting on transport. It has to be a secure vehicle that she can be secured in. So we've been waiting for that since 4:30, I believe.
I'll chase that up. Does a patient need any cages or anything like that?
Yes.
St Mary's, like most general hospitals, doesn't have its own psychiatric beds on site.
We've got this lady assaulted staff last night, quite aggressive verbally and physically.
A liaison psychiatry team based at St Mary's but employed by a separate NHS trust must assess and transfer mental health patients to off-site psychiatric units or arrange treatment for them in the community.
She needed to be restrained as well?
Yeah.
Security or police?
Security and police.
It's the job of the team's deputy manager, Million Moyo, to secure a bed for the patient.
The problem is the logistics, because we don't have wards on site. They need to be transferred elsewhere. And where we transfer them, quite often there are no beds. It's very unusual that we've got a bed ready for a psychiatric patient.
Hello. Well, as for now, she's calm, but we can't predict what will happen next.
We are giving her medication so that the transfer can go smoothly. Is she safe? Is she safe?
Yeah.
Okay, that's fine. Oh, you are at St. Mary's Hospital. You came to the hospital yesterday, and when we met you, you seemed quite confused.
Yes.
Do you drink alcohol?
No.
And do you use any substances?
Crystal.
Crystal. When is the last time you used crystal?
I don't know how long it is.
You don't know? Are you feeling sleepy?
Yeah.
Last year, 2,300 mental health patients attended St Mary's A&E, an 8% rise on 2015.
Compared to maybe even 6-8 years ago, we're seeing more people showing up to our A&E departments in crisis. These people don't know where to go to. If they've newly become homeless or living on the streets or newly been diagnosed with a mental health issue, they might not always know where to go. But everyone knows if you turn up to an accident emergency department that we will see you regardless. You know, if they don't come to us, they're not going to get help, and then things will turn out a lot worse for them.
It's getting to over 24 hours now. This is a very long breach. 12-hour breaches are considered very serious, and the chief executive gets informed.
The government sets targets to prevent long waits in A&E. If these are breached repeatedly, the hospital can face financial penalties.
We do take breaches seriously. We do strive to try and get our patients into beds as where we can as possible. Our mental health breaches is very difficult to try and actually do anything about them because they're out of our control.
She's just as ill as our other patients. She's iller than our other patients, and we can help them and look after them. And we can't do anything other than wait and wait. And if this was my sister or my mum or a friend or anyone, this wouldn't be good enough. It's not good enough.
We have had patients here for 36, 48 hours, young, vulnerable patients and elderly, vulnerable patients. And it is disgusting. And sometimes we just feel like our hands are tied and we can't do anything else. So all we can do is do our best for them.
Hi, it's Million. I've got a dilemma. A bed has not been identified. For this lady, they actually refused the patient a few minutes ago. Yeah, I know, and I've been calling everybody. We may be lucky to get a bed in the next few minutes. I'll call her back in the next 20 minutes. Hopefully we can hold on to the transport.
A private ambulance is booked to take the patient to an off-site psychiatric unit.
We're authorising hundreds of pounds worth of transport for these people to go to a safe place.
I'm doing my best. We're just waiting for a go-ahead.
How long's that going to be? Because we got told 10:30 go.
Yeah, I think let's wait on those 10 minutes and see how it pans out.
Are you happy with that?
We're going to have to tell our control, though, because we got straight in, straight out.
Transport are just waiting and they're just about to cancel.
Have you got a place for her yet?
Not just yet. It is actually this phone call.
He's on the phone now. Can we leave it 5 minutes and then call you back? Is that all right? OK, they're standing here, so... All right. Thank you. Bye. They're going to give us another 5 minutes for him to finish his phone call.
I just want to check about this lady you're expecting. What time we can transfer? 2:30. That's fine, agreed. The bed is not ready, which is really a bad thing.
Bad, it's unacceptable.
It's not acceptable.
Yeah. So why is it going to take 2.5 hours?
For them to prepare
Yeah.
bed. Well, they need to move another patient.
But that takes 2.5 hours, why? I know it's not your fault, but I need an answer. Everyone asks me why, and 2.5 hours is...
They also need to get an additional member of staff who's going to start at 2 o'clock.
OK, so this patient leaves here at 2 o'clock.
That's fine, agreed.
What do people sort of think of psych liaison in the hospital?
Those who understand how we work, they appreciate us a lot. And those who don't, sort of lose confidence with us. But I understand the pressure that they'll be going through.
It's not fair on her, ultimately, or anybody else here either. So we need a definite time for bed, and they can't keep changing it, so I'll rebook transport now. So a new crew for 2 o'clock, and the patient goes at 2 regardless. They'll have staff in a bed at 2 o'clock.
All right, 2 o'clock, yeah?
Yeah, please.
I need to speak to someone regarding the mental health transfer.
Whose fault is this?
Well, it's nobody's fault. It's just the whole fact we have no mental health beds for all of these patients, and that we don't have enough. So it's not one person's fault, so to speak.
I have to let you guys leave.
Okay.
So possibility is that you might get a call back on it later, but for now, I'm afraid we're gonna have to cancel it.
No problem at all. You just spoke to our office, have you, or do you want me to do it?
Yes, so that's all been
Yeah.
done. So
All right.
we've made the contacts. And
Excellent.
That's fine.
Okay.
I am so sorry.
Hey, don't worry about it. Things happen, don't they? All right, all right.
Did you enjoy
I had my lovely cup of coffee.
It's so frustrating and becomes so ridiculous sometimes that we can spend 12 hours of a shift and then my colleague can spend the next 12 hours of a shift trying to help these people, trying to find them a bed where they can go to so they can get the correct care that they need. And in the meantime, they're sitting in a cubicle in a busy A&E department with all hell breaking loose around them sometimes.
Three hours later, after 29 hours in A&E, a bed in a psychiatric unit is found for the patient.
Do you ever feel undervalued?
Occasionally, I have felt undervalued, but not by patients. I think let's leave that at that. Get her mum's number. Ask your colleague to get her mum's number.
There's been just so many cuts in all areas of our social care in this country, and it's just so frustrating that anyone in society that doesn't know where to turn, they will come to us, which is fine, and that's what we're here for. It just makes our job very, very frustrating. It's also very frustrating for them and their families, because we're not the right people to help sometimes. But in their eyes, we're seen as the only people that can help them.
We've got 4 patients with mental health issues in our department, and they've been here for really rather a long time, but they do all need a formal mental state examination by a psychiatric liaison team. So
The referrals have been made, have they?
yeah, they've been made many hours ago.
I've already had a Barney with the A&E staff this morning, and I just basically told her, you just can't keep bleeping and asking about every single case. I said, I've come in to 5 cases, one of them's absconded already.
75-year-old Carl has dementia. His family brought him to A&E after he became aggressive at home. Yesterday morning, he walked out of the hospital and was missing for 13 hours. The police found him wandering the streets alone and brought him back to A&E.
3 people to look after him at the moment, including security, because he's in an unfamiliar environment. It's noisy, it's bright, there's lots going on. I suspect that that's really playing into his underlying diagnosis and making things much worse for him.
For his own safety, Carl is being held in room Q, the space reserved for psychiatric patients.
So we've just been asked to come and see to make sure that you're okay.
Do you know where you are at the moment? Do you know where you are?
Yeah.
Yeah. Can you tell me?
What then?
It's very confusing though. He's got a history, got a diagnosis of dementia already, but it sounds like from his presentation that he's really deteriorated in the last month, really.
Where is he? You need to shout for help. Where is he? Which way did he go? Right, chase him.
Where is he? Not standing with you.
Carl, so let's go into this room here, like where there's comfy seats.
Come and have a sit down, Carl, please. Come and have a sit down, please.
It's taking up quite a lot of resource in the A&E department whilst we try and stop him from leaving. He doesn't really want to be here.
Carl?
Yes, mister.
I'm Dr. Matras, I'm a psychiatrist. How are you doing, sir? Are you okay? No, are you okay? Are you doing well?
Yeah.
Perfect. Do you know where you are?
Yeah.
Could you tell me?
Are you sure if it's yours or not?
Again?
Are you sober or not?
Sober. I am sober, yes. I'm a doctor. I'm sober, sir.
We're finding it hard. It is hard and stressful. And just seeing him today is just heartbreaking. Really, really heartbreaking. My mum's on respite. She's gone on a 2-week respite, so myself and my partner's actually caring for Carl. And that's when we, started finding more changes with him. I don't know if it's the circumstances that, his routines kind of change compared to when my mum's around. I think that might be the cause of why he's in there today. Are you looking for your wife?
Yeah.
Yeah.
Do you think he's missing her?
He's definitely missing her. He's definitely missing her because he tries to ask for her.
He normally lives with his wife, who is away now. I think she's due to return quite soon. He doesn't have the history of aggression, but he has become aggressive. But daughter thinks that has deteriorated over the last 3-4 days. He's much more confused. He's much more jumbled up. He went to visit his daughter, but he confused the addresses and tried to force entry to somebody else's home. That's not good.
My concern is having him on this busy ward.
He needs to go
So I
somewhere
think
else,
he's getting agitated with all the people around him, the noise.
The main problem will be he's wanting to leave and go, because that's what he normally does.
Can you just tell me what's going on with this guy? What the dilemmas are?
First of all, we are not entirely clear why there was a change in his behavior. The investigations that have been carried out don't show the evidence of any medical cause that could be attributable, but at the same time, it doesn't exclude that. So there'll be a question whether he could be admitted medically for further investigations. That's something that I will need to discuss with the medical team, because they may say that, unfortunately, it's not necessary for him to be admitted. So then there'll be a question who will be arranging the increased package of care, because he's unlikely to be able to return home without increased package of care.
Psychiatrist Bart works for a different NHS trust, so he can't admit patients to St Mary's. Instead, he must ask one of the duty doctors to find Carl a bed.
Hi, how are you? Hi. There's a chap in here called Carl, brought in last night with increased confusion. So he normally lives with his wife, but she's away. Communication with him is difficult, but according to a doctor, he's even more jumbled up. You know what I'm trying to say?
So there's acute and chronic confusion, a safeguarding issue, and...
Well, not necessarily
well, but might need an increased
package of care.
Care or something.
And he won't be capable of going back home at the moment.
Yeah, he'll get admitted to AMU.
AMU.
There will be beds. He'll get the whole screen, and we'll see what's chronic and what's new, and what's reversible and what's not, and what you know. All right.
Awesome.
All right.
Thank you.
No problem.
Thanks again.
Our longest waiting patient is going to go to the medical ward now, so he's going to the acute medical unit.
And how long has he been here?
13 hours and 46 minutes.
What do you think of that?
I don't think that's best patient care.
Is mental health given the sort of priority that physical health is?
Yes, in terms of the care delivery from within this hospital, but no in terms of the budget that it has across the whole country.
It doesn't have parity?
No.
Get her away! Move on. Girl, don't let her touch me. Please.
Stanley, that's not nice.
Don't let her touch me. But no!
Okay.
85-year-old Stanley has vascular dementia. This is his fourth admission in 3 months.
Push me back.
Where do you want to
Backward, about 2 feet backwards and then right.
Okay, we're going now.
Around 25% of medical patients treated annually by the Trust have dementia. They are accommodated in a specialist ward until their social care can be arranged.
Stanley. He remains medically fit. In terms of discharge, then, actually the only thing we need is a package of care. What are we waiting for?
As he can no longer cope living alone, Stanley's family, along with hospital staff, have decided he needs a place in a care home. He's under the care of the complex discharge team.
So I've spoken to the CCG, and they said that they haven't heard from the commissioner. So by midday tomorrow, hopefully we'll get the answer for the funding that we're asking. So yeah.
Good stuff.
And then we'll start looking for a care home.
If you get on well, this is where you come, and that's what we expect. But I think there's probably more that we're seeing of people whose social situation has just reached a breaking point. I think we're just seeing more people in worse crises as it gets more difficult to access social care or to have your problems met in the community.
No, don't turn me right. Get this way. Ahead. No, you're turning.
Stanley?
I mustn't be turned.
Stanley?
What, darling?
Remember I told you no screaming. I was assigned to look after Ole because he's quite confused and he's very demanding as well. He's very off and on, screaming, shouting.
Look.
Careful.
Oh.
Asking for so many things that you can't really figure out sometimes. Well, that's our job.
Are you waving to everybody?
What?
Are you waving to everybody?
where he is, Peter?
I have not got a clue. I can ask him. Do you know where you are?
No.
In St Mary's Hospital?
Yeah.
And do you know where you're going to after?
Where?
Do you know where you're going to go to after?
No.
A nursing home?
Oh, my back. Oh.
It's cool.
Do you know where you are?
Me, I'm with you.
Where?
St Mary's Hospital, Paddington.
Dementia's not an illness per se, it's a series of different illnesses, like Alzheimer's. People tend to notice things like the memory loss, but dementia is more than just memory, it's also how you think, how you behave. It can completely change someone's personality, massively affect how they function. Dementia is one of the worst things that can happen to you or someone you care about.
He had about 10 weeks in and out of this place because he keeps walking around the area, occasionally semi-clad, shall we call it, on his electric scooter. Oh, he broke down on the Westway once. My brother Tony got a phone call to say could he come and pick him up. When he got there, he realised he was actually in his electric wheelchair. So there's a big, rather large traffic jam. So he just gets confused. 3 to 6 months ago, you wouldn't notice it. He wouldn't have been like this at all. It'd be totally different. And then 2 years ago, it'd be like you and me. If you're like normal, I don't know what normal is these days. Because of the illness, he shouldn't be at home. They're going to find you a nice home.
Can't hear.
They're going to find you a nice nursing home.
It'd be nice if you could find somewhere tomorrow.
But sometimes he actually thinks he's already in a home. And the last time he came in here, he said, I should have come in here a long while ago, not actually realised he's already been here 3 or 4 times in the last 6 weeks. I don't know where it's going to end up. They said there's a home for him eventually, but it's just when I suppose they can find a place.
Stanley is your patient. He's waiting nursing home placement, I noticed that, and he had all his documentation sent down to the CCG. He was granted continuing care. Yeah. Sometimes, you know, patients that are challenging take a while to be placed, because in the wrong place, they will be back in A&E with people not able to manage them.
I think this is called acting natural.
The stocks for nursing homes are low, and the demands for people to go into them are high. And they may not, you see, like Stanley, he has to be placed where they can meet his needs, where his risks can be managed, and where his challenges can be managed, and also to protect him from harm and neglect.
He needs somebody around all the time to help him and to provide some guidance and reassurance and make sure he doesn't get upset and agitated and angry. And, you know, potentially he's going to need a member of staff looking after him quite a lot of the time. That's really, really expensive.
He's shattered this, isn't he?
Remembering what he was like before and now is it's heartbreaking. He's been like a dad to me, practically all my life. Taught me how to do many things, you know, taught me how to drive. That was one of the great things, learning how to drive.
Play cricket?
Play cricket.
He's always been there.
Yeah, he's always been there.
It's quite sad seeing him in this condition.
When he was a younger man, what was Carl like?
He loved his cricket. You know, he always played cricket, and he's a bus driver, and even up to today, he talks about the buses. Those are his 2 main passions.
Which route was it?
182. That's his bus. 182 to Harrow Wheelstone.
So what's happening now?
It's going to be day by day. See how he gets on day by day, and then we have to decide what we're going to do if he's going to come home. My mum's the main carer. She's on respite. She wanted to come back home straight away, but I tried to persuade her that it's in hand. You know, we're dealing with it. She's very upset, and she'll be back soon. Yeah, it's very sad. I don't think she's come to terms with what's happened to Carl, actually. I think sometimes maybe she's trying to block it out.
Do you think she can continue to look after him?
To be quite honest, I don't think she can. I think she'd like to believe she can, but don't think she can. They said once he sort of like sleeps and revives, they'll just see how he gets on. She's not the same person as what she was. That's one of the reasons why she had to go on respite. She was drained.
Do you have a tough decision to make?
I don't really want to make any decision because that would be in the hands of my mother when she comes back on Saturday. I don't want to make wrong decisions, so I'd rather just wait for my mum to decide what she wants to do. OK, thank you. Right, thank you, bye.
So he was working 4 years ago, working as a bus driver, and they said it's been more like a year, but the last 2 months have been worse.
And he's just been under the memory.
So on examination, he's very well. Not obviously. Carl?
He's looking for the way out. Now he's restless and agitated. Carl, come and wait here, please.
See? Oh, is it? I don't think it's.
Go ahead.
This is
No way, there is no way out.
Can I show you the toilet? Surveil you. Oh, don't let her. Don't open the doors.
Carl, how are you? You alright?
Don't hit me. Why do you hit me?
Don't do that.
Why do you hit me?
How did he go out?
Be careful, don't let him hurt you.
Don't worry, I'm fine. Yeah. Can I get back up, please? Back up, please.
Okay.
Just relax. Okay?
This is his bed.
Carl, what's wrong? It may look heavy-handed, but patients like Carl are very unpredictable. The security's there really for his own protection. Oh, look at me. It's all right. Carl.
Be careful. Don't worry.
Carl, just calm down.
It's all right. Well,
no, it's all right. I'm not doing anything. I'm not doing it. You don't have to do that. We're here to help you, okay? Are you okay with that?
we need to find a signed room. He's going to end up harming a patient. In the bay, so.
Yeah, I've done that one.
Yeah.
It's all right. No one's going to do anything that you don't want.
That's it.
Did he hit you?
No, he hit me.
You all right?
I'm okay. I'm okay.
Is this one of the risks of your job?
That's it. You must expect this. You have to expect all that aggression, so you have to prove it. You can't blame him at all. So now they've put the care on 2 to 1. It's going to be 2 to 1 now, not just one person.
It was very difficult. He just tried to kick the consultant in the face twice. Yeah, on the face take order. I mean, we're giving him oral antibiotics now. I mean, his inflammatory markers are non-exciting, so there's no systemic illness going on. So, you know, were it not for his deterioration, you know, we'd be discharging him. There's nothing being done here that can be done anywhere else. You know, is there anywhere more appropriate on a different, you know, within the mental health setup that, because he's going to end up harming himself or someone else, you know.
He's medically fit, isn't he? There's no need to be in hospital.
We're making a guess, really, that he's got a urinary tract infection, but the evidence for that is poor. But right now, yeah, he's someone who could come to harm if he's not around people who can care for him. His main carer is taking some respite care. Quite clear that he needs to stay somewhere where he's safe, and that place right now is a quieter bit of the hospital. So we're not in a situation where we can send him home straight away. Okay. Well, all the best.
Yeah.
Carl's wife, Patricia, has returned from a respite break visiting relatives in the Caribbean.
Do you know where you are?
Yeah.
Yes or no?
Where is it?
It's St. Mary's Hospital.
When I get the call, everything just drained from my body.
I started to cry. I said to Sandra, I'm going to try to get a flight to come back home. She said, don't come, Mom. It's nothing I can do. I felt so bad, you know? Hi.
Hello. Hi.
Kiss me. Good one. You remember who I am? Who?
Peter. Peter?
No, I'm not Peter. I'm your wife.
That's good.
I'm your wife.
Oh.
You forget me?
No.
Pat?
Me too.
You remember me now?
Huh?
You remember me?
Yeah.
Before I took the 2 weeks, I was at the edge. I was at the edge of it, breaking down. Been a good boy last night, no fighting?
Yeah. I don't fight, you know.
I know you don't fight, I know. So that's what really... I did need a holiday because I can hardly cope. Because his features changes.
In what way?
In a way like aggressive way. In an aggressive way, I can see when his features changes. I have to tell him, let's go out for a walk. Because I get scared at home. Yeah. All right, babes? You miss me?
All right.
Kiss me.
How many years have you been married?
25.
25.
Yeah.
And then 15 and then 20. Yeah. Maybe 30 years.
Good boy.
Do you think you can take Carl home?
Carl is still mobile. He's strong. It is hard for me to put him in a residential home. And at home, I cannot cope. I don't know what's going to happen. So I'll see you, yeah? We have to go now. Don't get upset. They're looking after you and they care for you. Carl, please.
So that and Bob is okay.
Stay inside. You're making me feel sad.
You have to stay here.
You cannot come out now.
Relax, watch some cricket, we'll come back.
Yeah.
If it's do?
Watch some cricket. Cricket, you know cricket? West Indies? The West Indies?
Yeah.
Yeah? Watch them. Watch them do bad again.
I don't know what's going to happen from it. Because he's talking about places he wants to go. I don't know.
Carl's case is passed to the complex discharge team, who will assess his needs to see if he's able to return home.
Can you lift my side up?
Yes, I'll do that. Yeah.
Stanley has now been in hospital for 21 days. His family are waiting for the results of a care home assessment.
All patients going into nursing homes have an assessment, especially with complex needs.
What do you think they're going to say?
It would depend on the clients they have already got on board in their nursing home and would Stanley fit into their home.
Stanley's care home will cost £1,700 a week, plus, because of his complex needs, an additional £2,300 for one-to-one care. It will be funded by the NHS Continuing Healthcare Scheme.
But Peter,
You all right?
but no, Elizabeth.
You all right?
What is a fire?
I've got something for you, Dad.
Oh, what is that?
You think that goes there,
We went to view the home.
Why?
For you, a different place for you to go in with your own room. It was nice. Your own room. Meet some nice new people.
Hello, is that the home? We come this morning regarding my father, Stanley. She said there'd been an assessment done, and she said she can't say anything to us until they hear back from your person who came and assessed him this morning.
Would you like to get there?
Yeah. It would cost a lot.
No, it doesn't cost us anything.
I was just wondering if I can sort of preempt things a little bit and wondered if there'd been a decision made. It's just that we're sitting with my father, and obviously it'd be good if we can give him some good news.
Thank you.
OK, then. Thank you very much. She said, it's all looking fine. As far as they're concerned, it's a yes, but because he needs extra funding, because he needs more one-to-one care than they're willing to give him with the resources they've got, it has to be funded by the NHS, and you won't know that until Monday. You just have a man in the middle who has to say yes about funding, even though the funding's been agreed, but not for the additional care.
OK, so the fact is we still don't know.
No.
Everybody was full of sort of hope this morning. You know, there's been a lot of stress over this. People travelling from hundreds and hundreds of miles regularly to come down and try and sort it and help it out. And we're still here, we still don't know. And what if they say no, then we've got to find another place and start again next week. And then will we still have the same issues?
Do you remember this one? Just sideburn. See? That's your sideburn. Very proud of it, eh? Yeah, when you had your sideburn. And this one, I think we went away for a weekend. Yeah. I can't remember if it's, yeah.
All right, let's start with Carl. So he remains medically fit. I think he seems a little better today. We had a bit of a conversation about the cricket, which was sustained, which was nice. I haven't met his wife yet, but I think she's around this afternoon, so I'll have a chat with her after the meeting. In terms of discharge then, actually the only thing we need is a package of care.
Yeah, it's all just social services we're waiting on, and they want to make sure that there's something in place before he goes home.
Well, I'll have a chat and we can talk about various things, but either way, he should be getting out of here soon.
Yeah.
Good.
Oh, we had our good times together.
We used to go to
Yeah, we had our good times together. I know he would look after me. He would look after me the same way. And I prepared to look after him as well. But in his condition, all I am asking for is a little support. You know, just to ease the pressure off me, that's all.
Hello.
Yes?
Dr. Mitchell.
Oh.
Nice to meet you.
Andy, yeah.
How are you?
I'm good, thank you.
So, I've heard that there's been obviously quite a lot of challenge, let's say, in terms of, you know, just being able to cope and keep things going at home. Sounds like you've done a pretty remarkable job, frankly.
I try.
Would another carer being there either during the day or at some points during the week, so at least there's somebody around for a while so you can get out of the house, would that be of some use?
Well, yes, if I can get out, you know, or even a day in the week, you know, I could say, well, Wednesday's my day. You know what I mean?
Yeah, that's good. I'll be honest with you, that's going to be difficult. You won't get somebody there for a whole day. Typically what social services will do is they'll get you a carer like for half an hour in the morning, half an hour in the afternoon, 7 days a week. It's not going to be able to do everything that you've been doing, because what you've been doing, frankly, is incredible. That's potentially going to be an ongoing challenge, I'm afraid. If Patricia had known months ago that she could get some support, then maybe it wouldn't have got to the stage where she's so exhausted she can hardly imagine how she'll carry on. But I guess that's what people often do. They just sort of soldier on as long as they possibly can.
Listen, if you want to come home, you have to behave yourself. Come here.
Are we set up to help somebody in her shoes?
No, I mean, these things are incredibly complicated. You know, I've been doing this as a consultant for 5 years, and I still get baffled as to how some of these things get sorted out.
Are you okay? Are you okay?
Yes, thank
you. Are you
you.
comfortable here?
Yes, thank you.
It's quite busy.
We came in this morning. There have been patients in the department for over 12 hours, mostly psychiatric. So the problem that is that it takes up a quarter of the department. They're keeping an eye on them, keeping them safe, making sure they don't abscond, making sure they're not too distressed, looking after all the other patients in the department at the same time.
Trauma team to adult A&E Marisa.
56-year-old Stephen has been brought to St Mary's by London Ambulance Service after self-harming with a knife. He needs emergency surgery to repair his arm.
This is the RMN, so the sort of psychiatric nurse, she's basically explaining why he's done it. He stated he deliberately did self-harm because his benefit, he said, it's been stopped. According to him, he was unable to get support, to have his voice heard. And this is the trigger, if you like.
How awful if that's the only way you feel you can get attention?
Yeah.
Mental health patients are more likely to encounter trauma. Illness that affects your behaviour and impairs your judgment makes them more prone to accidents or occasionally self-harm. So it does represent a significant proportion of our workload. We're quite busy and we're quite stretched as it is. So in order to cover this list, I've had to take a very senior doctor out of another list to cover. So we're stretched a bit thin.
I'm hoping for him that this is a sort of a lucky escape, as it were.
We get involved insofar as we obviously stitch them up and repair whatever's damaged, but this is clearly the manifestation of something more significant in this poor gentleman's mind.
You know, I think it's no secret that we're having a bit of a crisis with mental health at the moment in this country with the provision of care.
They won't present to hospital until things have really got out of hand. If they're at home, if they're having a psychosis, if they've got lack of insight into what's going on with their own health and they're not really taking control of it as well. So that's why we need more support in the community, really, to make sure that they get the appropriate care when they need it.
After 24 days at St Mary's, Stanley is being discharged to a care home.
I wish you all the best, my friend. Yeah. And you know what they say, I don't want to see you again. No, I say I love you. I hope you don't want to see you again. I hope you're aware of that. All the best.
Been hoping that this would happen so someone else can have this bed. Because my dad's care could probably be done better elsewhere. And someone else can have this bed, and I'm glad of that.
Thank you for everything and all your staff and health visitors, you know.
Thank you very much.
You're a good girl.
A pleasure.
In a way, it's sad that it takes so long because we were adding up the amount of cost for somebody like my dad to come in and out of hospital about 4 times. Wouldn't it be great if we could cut that process down so people could be moved more quickly into a place rather than hospitals? But we do appreciate everything the hospital have done.
Right, here we go. Goodbye to every little one we know.
Goodbye, young man. Take care. Super. Stanley, hello.
We're back again.
Super. You okay, guys?
The wheelchair that he's sitting in, he fits in. The wheelchair they've got to take him in the ambulance, he doesn't fit in. This wheelchair is not allowed to leave the hospital, and if it does, they can't fetch it back because they say they're going to another job afterwards. So now they might need to find another wheelchair or change the ambulance. They're waiting for a wheelchair for you. The problem is he will get irritable if he thinks he's not going.
Push. Push.
Hi, Stanley.
1 minute. We're going down. We're down to 1 minute now.
Right, we're going. Everybody, 1, 2, 3, and go. Excuse me. Push and push.
Just got to wait for your wheelchair.
If you're not going, I'm going. You're fucking about.
We're not.
Then suck off there. Get off. Get off.
An hour and a half later, a second ambulance arrives.
Let's hope we don't see him back in here again.
Bye-bye. Bye-bye, Liz. Bye, everyone.
Just get her off the scoop and we can trap her down and release you.
Yeah. Uh-oh. What are you doing?
Huh?
What are you doing?
It's true.
No, no, no.
Oh.
I need you to sit down. Because otherwise you're going to trip up and fall over. Do you need the toilet? Do you need the toilet? Okay, step off the blanket. Okay, well done. We're on the run. This morning we had a huge amount of psych patients. Patients that have been particularly difficult is we've got a patient in with quite advanced dementia who's needing a lot of attention.
What's he done this morning?
He's covered my department in poo multiple times. And so I've now keep moving him and the poor domestic keeps following me round. So, but we're getting there.
How are you feeling? You okay? So all was fine for the operation. Your cuts, we've stitched them up, so that's all okay. Most of the structures were all fine. How are you feeling? You feel good? Any pain in the hand at all, in the arm?
Hello. Hi. I'm Dr. Matias. I'm a psychiatrist. My understanding is that you've been feeling increasingly stressed out because of the problems with the benefits, to the point that you decided to cut yourself because you didn't want to live anymore with these problems.
A year ago, Stephen lost his voice due to complications from throat cancer.
You are the shadow of the man you used to be. And is it because of your medical condition? Okay. And did they tell you about your prognosis as well? What's going to happen in the future with your throat? What did they tell you? That it's going to spread. Now, when was the last time that you saw a psychiatrist? 6 years ago. What did you see them about? About depression or about something else? Anger issues, okay. Did you have any trouble in the past? Any trouble with the police? Did you end up in prison at any point? Long time. How long did you stay in prison? 20 years? 10 years, okay. There's a question whether you would need to have someone with you all the time in the hospital. Because you harmed yourself in here, they are worried that you may cut yourself or do something to yourself in the hospital? No? What would stop you from doing it? That's enough. That's it. Okay. How do you feel about being alive now? Do you feel a relief or do you feel disappointed? You're hopeful. Okay. Thank you very much.
So you cut your wrist to get some attention? Because they were going to evict me from my flat, what was not my fault. And is that what's been upsetting you? You'd rather be dead than lose your flat? Why did you think this was the best way to make a point?
because they don't listen to reason.
It was quite clear, had he not had the financial problems, we wouldn't have met today. Housing problems with benefits are the recurrent theme and quite often the major source of stress that leads to patients presenting in crisis. And quite often, yes, we have to pick up the pieces.
Hello. Hello, hello. Hello, hello. Good boy. Hello, I'm Alice. How are you?
I'm good, thank you.
Hello. And how are you?
Very, very, very bad.
How are you coping?
Very hard. I can't cope.
How long have you been looking after your husband with this condition?
From December 2015.
So
the whole of 2016.
Yes, yes.
And when I was going down, I was breaking down when I
Right.
called my GP. I said, I cannot do anymore. I feel I'm going down and I've got health issues as well.
Yes. So you felt burned out?
Oh, Alice, to be honest, I was on the breaking point.
Right.
I want to look after my husband the best I can, and I always promise to look after him. But there's a limit, because else I'll go down before him. So I just feel I'm going downhill.
Of course.
It's too much for me.
Yes, but you just remember that we try to look after the carers.
I want to look after him.
Of course. But we do understand the stress and strain that you are under too.
I look after him for 1 year. All they gave me, which I think is unfair, a pile of papers to read. And they left me, they left me. I didn't know where to turn.
Yes.
I didn't know where to go.
So you feel that you've been in the wilderness?
In the wilderness.
With no support?
No support at all.
Right. Well, I will try my very best to get a meeting together with social worker at the hospital here. All right.
Yeah, that's fine.
All right,
Yeah,
and lovely to meet you.
Alice. Thanks
Take
for
care.
your help.
That's
yeah?
okay. Thank you.
Okay, thanks.
And are you all right, Cal? You've had a nice wash. All right, Tricia.
Yeah, thank you, Alice.
All right.
Thanks,
Nice to meet you.
Have you been to the toilet then?
Yeah.
Number 2?
What I can.
You're number 2?
No, 6.
You look nice on that, Carl.
Carl has been in St Mary's for 11 days. Today he's going home. Social services have agreed to fund a carer for 2 hours a day, 7 days a week, to help Patricia look after Carl.
Patricia, how are you feeling this evening?
A bit anxious, you know, excited. But my concern is at night, when I'll be with him alone. I don't know, I might not sleep tonight. I just have to wait and see his reaction and how he behaves. If he wants to get out, I cannot stop him.
Carl, stay still, please. You need to stay still. You need to stay still, Carl. Sorry. You need to stay still, please. No, don't push me, Carl, please. Please, don't push my shoulder.
That's fine, yeah? Well done. Come this way. Yeah, walk that way. Well done.
Probably when he gets home, you know, he might be a bit back to himself.
You're hopeful.
Yeah. That's all I can do, live in hope. Things looking up. I know where to go now for help. Hello, darling. Hello. Welcome home. Welcome home.
Home
You right?
again.
You home again?
Home again.
Yes. You're right. How is it? How are you?
This way, is it?
All right?
I'm all right.
You're
I'm
all right.
right.
Oh, happy to see me, huh?
Are you happy?
Of course.
uncle is in a mental health unit. I visit him every day. I wish a miracle could happen to get back to normal. You know? And that's all I can do is to pray. Pray for him.